Aloha, everyone. I hope that you're choosing behaviors that produce positive and desirable consequences. Welcome to Dr. P's Facets of Life series. This is pod number 21. Today's topic, falling apart. What might you be thinking about that topic and those words? Please bear with me while I explain that those words are not intended to imply that I will be talking about a nervous breakdown. No. The topic title is a bit of a hybrid, part truth, part symbolism, in order to get your attention. What I am actually going to talk about is fall prevention. Please stay with me here because even though you may feel this is not a topic that could apply to you or that you might not be interested in, I really feel strongly that everyone should have this information. At some point in our lives, we will have a relationship with the idea and knowledge about prevention. My guess is that at some point in your lives, one of these scenarios may apply to you, such as you currently have a relative or friend who is considered a fall risk. That person is usually someone elderly or with medical conditions, or both. These conditions can be physical, cognitive, or both. Another scenario, you will, at some time in the future, have a relative or a friend who will become a fall risk. And finally, you yourself might currently be a fall risk or might become a fall risk. This is just one of life's harsh realities. The thing is that many of us are not aware of the consequences of not understanding and implementing fall prevention when appropriate or before falls occur. Falls can create untold physical and emotional hardships for both the patient and the caregivers. Those most at risk for falls are not always the elderly among us. Anyone, any age, with one or more medical issues, we call this comorbidity, can be at risk for falls due to things like poor balance, diminished strength, dizzy or lightheadedness, multiple medication effects, high or low blood pressure, back and or spine problems, and cognitive decline. The list is very extensive. What are the possible ramifications of falls? I'm glad you asked. That list is also very extensive, but let me share with you some of the most common scenarios. A person who is elderly and or health compromised takes a fall. That person has to have hip surgery, goes to residential rehab but stays longer than expected. That person is then released to go home, but must have lots of help in order to stay at home, or must go to a residential facility. In a worst-case scenario, that person has to spend too much time in bed and develops bed sores and subsequent infection, or worse, develops pneumonia and cannot recover. The person could ultimately die. I don't offer that scenario to frighten you or to be overly dramatic, but that kind of situation happens quite frequently. Another scenario would be a person who falls frequently and although breaks no bones, instead suffers head trauma. That can result in brain damage or be a contributing factor for many strokes over time. Then there is the simpler but no less challenging scenario of falls causing minor injuries that do not require surgery, hospitalization, or rehabilitation, but can nonetheless be debilitating in some way and require attention and a period of recovery that will likely impact loved ones. So, how do we go about learning to prevent falls from happening, or at least decrease the odds of their occurrence? Well, here are some things to consider. Medications. Review them with your physician, including vitamins and supplements, on a regular basis to avoid adverse drug interaction. Be aware of mixing alcohol with medications when contraindicated. Health issues. Be aware of anything that could contribute to falling, such as eyesight, inner ear, joint pain, numbness, shortness of breath, and even poor hearing. Home hazards. Remove clutter and trip hazards, such as throw rugs, cords, poor lighting, and slippery surfaces. Sensible footwear. Wear shoes that give good support and do not increase the likelihood of slipping or losing one's balance. Wear shoes that are appropriate for any activity. Assistance devices. Be practical, not prideful. Make use of grab bars, seats, stools, canes, walkers, grabbers, tub and shower aids, and toilet aids. Finally, keep moving. Exercise is critical for maintaining strength, balance, coordination, and flexibility. Things like walking, swimming, aqua gym, yoga, chair yoga, tai chi, stretch and tone. There are all sorts of exercises that can be age and physical condition appropriate. If you have any questions or concerns about the potential fall risk for yourself or someone else, see a physician. Then have either a professional and/or the local fire department come to your home to do a home assessment. Remember the old adage, an ounce of prevention is worth a pound of cure? Please think about that. That's it for this time. Share your gifts, share your talents with others, and remember that gratitude is the best attitude. This is Dr. P saying aloha.